Have you ever looked in the mirror and wondered, when did I stop paying attention to myself? Maybe it's the way your energy fades earlier in the day now, or how certain things you never thought twice about, well, they've started to feel different. And I mean personal things, private things. Let's talk about that. When we think of aging, we often focus on our joints, our memory, maybe even our heart health. But there's one part of the body that many men forget to talk about, yet it quietly affects so much of our daily life. Self-esteem, relationships, and even dignity. Yes, I'm talking about your penis. Now, before you chuckle or feel a little uncomfortable, let me say this. Clearly, there is nothing embarrassing about wanting to take care of every part of your body, including your manhood. In fact, it's essential. Because as we get older, what once worked effortlessly may start sending warning signs, maybe a little less firmness than usual, maybe more trips to the bathroom, maybe a drop in sensation. But here's the good news, you're not helpless. There are simple, effective ways to care for your penis after 60, and today, we're going to talk about exactly that. I'm going to walk you through 5 essential steps that every man over 60 should know, not just for sexual health, but for overall well-being. These aren't gimmicks. These are practical habits that can protect your confidence, comfort, and quality of life. So let's dive in, starting with something most men overlook completely: blood flow. You might not realize it, but your penis is basically a barometer for blood circulation. If your blood flow slows down due to age, clogged arteries, or a sedentary lifestyle, your erections might not be as strong or lasting as they used to be. But this isn't just about sex, it's also about health. Because reduced penile blood flow can be one of the earliest signs of cardiovascular trouble. If your mornings no longer greet you the way they used to, that could be your body waving a little red flag. The arteries supplying the penis are much smaller than those to your heart, so issues often show up down there first. So, what can you do about it? Movement is medicine. You don't need to hit the gym like a bodybuilder. A brisk 20-minute walk, 5 times a week, is enough to keep your blood moving. Add in some light stretches or even chair exercises if mobility is a concern. What matters is consistency. Remember, your heart pumps life to every part of your body, and your penis is no exception. Now let's take this a step further. What goes into your body has just as much impact as how you move it. That brings us to nutrition, another essential pillar. And no, I'm not going to lecture you on giving up every food you love. But certain choices really do make a difference. Processed meats, high-sugar snacks, and fried foods. They might taste good, but over time, they stiffen your arteries, just not in the way you want. Instead, try adding more leafy greens, nuts like walnuts or almonds, and fruits like blueberries to your plate. Why? Because they're rich in antioxidants, help reduce inflammation, and support better blood vessel function, including in those vital areas. A handful of spinach or even a banana can improve nitric oxide levels, which directly supports stronger, healthier erections. And don't forget hydration. Even mild dehydration can reduce blood volume and affect your sexual function. So keep a water bottle nearby and sip throughout the day. If your urine is pale yellow, you're on the right track now. While we're on the topic of what goes in your body, we need to talk about something often ignored but incredibly important: medications. As we get older, it's common to be prescribed drugs for blood pressure, diabetes, depression, or prostate health. And many of these, while life-saving, can have side effects that directly impact your penis. You might experience a dip in libido, difficulty getting or maintaining an erection, or even a change in ejaculation. But here's the key: don't suffer in silence. If you notice changes after starting a new medication, talk to your doctor. You won't offend them. In fact, urologists often adjust medications to minimize side effects while still protecting your health. Sometimes, even a small dose adjustment can make a big difference. And don't ever stop taking something on your own, because unmanaged blood pressure or blood sugar is far worse for your sexual health than any side effect. This leads us to something most men rarely, if ever, discuss: regular checkups. You see, many men will take their car for an oil change like clockwork, but won't see a urologist until something breaks down. That mindset needs to change, especially after 60. Your prostate continues to grow with age, and it can press on the urethra, leading to slower urine flow, dribbling, or a frequent urge to go, especially at night. It's frustrating, I know, but the sooner you catch it, the easier it is to treat. Sometimes it's just a minor shift in diet or routine. Other times, medication or simple procedures can help tremendously. And here's something you may not know: some urologists now offer simple blood or urine tests that can detect early signs of cancer, inflammation, or infection, all before you feel anything is wrong. These are proactive steps, not reactions, and they can save not just your sex life, but your life, period. Think of it this way: you took care of your family, your job, your responsibilities for decades. Now it's time to take care of you, your health, your happiness, and yes, even your penis. Because you deserve to feel confident and in control, not embarrassed or uncertain. And look, I get it, talking about this stuff isn't easy. Many men grew up in households where topics like this were considered taboo. But silence won't protect you. Action will. And the older you get, the more important it becomes to have these honest, helpful conversations. So here we are, just two people talking, and I want you to know you're not alone. These changes you're noticing, they're normal, but that doesn't mean they're permanent. With just a little attention and a few smart habits, you can feel better, function better, and even live longer. Now that we've opened the door to taking better care of your penis, let's keep going, because there's something else that can quietly cause harm if left unchecked, especially as we grow older. And that something else is hygiene. Now, before you brush this off thinking, I've been cleaning myself just fine for decades, hear me out. Hygiene after 60 isn't just about soap and water, it's about being a little more intentional, a little more attentive. Because the skin in that area becomes more delicate with age, more prone to irritation, and slower to heal. Even small things like residue from harsh soaps, leftover urine drops, or sweat trapped under the foreskin if you're uncircumcised can lead to irritation, itching, or even infection. And if you've noticed redness, flaking, or an odd smell that doesn't seem to go away no matter how often you bathe, that's not something to ignore. That could be a condition called balanitis, which is more common in older men, and especially those with diabetes. It may sound unfamiliar, but it's simply inflammation of the head of the penis. And guess what? Most of the time, it's preventable. So, how can you care for that area properly? Use mild, unscented soap and lukewarm water. Gently clean the penis every day, especially under the foreskin. If you're uncircumcised, but never scrub harshly or use alcohol-based wipes or sprays. That skin isn't like your elbow or your heel. It's thinner, more sensitive, and it deserves better treatment. And once you're clean, make sure you're dry too. Moisture left behind, especially in folds or creases, creates the perfect place for bacteria and yeast to thrive. A soft towel, a patry knot, a rubes, all you need. If reaching or seeing that area clearly has become more difficult, don't feel ashamed. You can use a small mirror, or even ask your partner or caregiver for help. Dignity is not about pretending. You don't need spot, it's about taking the steps to stay healthy. Now let's talk about something deeply personal but so important: sensation and connection. As we age, testosterone levels naturally decline. You may notice a dip in your libido, or that physical intimacy feels different. Maybe you're not as responsive. Maybe you don't finish as easily. Or maybe your partner has noticed a change and you're not sure how to talk about it. These moments can feel confusing, but they don't mean you're broken or that you're less of a man. Not at all. The truth is, intimacy evolves with time, but that doesn't mean it disappears. One of the biggest myths I see among my patients is this idea that after a certain age, you're not supposed to care about sex anymore, that it's only for younger people. But that's simply not true. In fact, many men, in their 60s, 70s, and beyond, enjoy fulfilling intimate lives, but they do so by adapting, not avoiding. Sometimes that means slowing down, spending more time on foreplay, focusing more on closeness and less on performance. And sometimes, it means seeking a little help, whether through safe medications like sildenafil, or through therapies that improve blood flow naturally. But here's where many men go wrong. They reach for the little blue pill without checking in on the root cause. Pills can help, but only if your body is ready for it. If you're battling undiagnosed diabetes, nerve damage, or a weakened pelvic floor, the pill might not work at all, or could even be dangerous. So let's pause for a second and talk about your pelvic floor. Have you ever considered that your penis is not just about blood flow, but also about muscle strength? Right under your pelvis, there's a group of muscles that help control your bladder, bowel, and urethra erections. These muscles weaken over time, especially if you've had surgery, prostate issues, or sit for long hours. The result: more leaks, less control, and a weaker response when aroused. But this is something you can train. You've probably heard of Kegel exercises, and no, they're not just for women. Gentle pelvic floor strengthening, done just 5 to 10 minutes a day, can help you regain better control of your bladder and boost your erectile function. Here's a simple way to try it. Next time you're using the bathroom, try stopping the stream halfway through, just for a second. The muscle you feel working, that's your pelvic floor. You can squeeze that same muscle while sitting, lying down, or even watching TV. Start with a few gentle squeezes a day, hold for 3 to 5 seconds, and then relax. Over time, that little habit can lead to big results. And don't worry, no one will know you're doing them. There's no equipment, no awkward gym class, just a bit of focus and patience. This is your private training zone, quiet, simple, and effective. Now let's circle back for a moment. If you've been feeling discomfort, changes in urination, or a nagging sense that something isn't right, there's one more thing you need to hear. Trust your instincts. Your penis is not just a luxury organ, it's a messenger. It tells you when your blood sugar's off, when your blood pressure is too high, when your nerves aren't firing right. It tells you when you're stressed, tired, or not treating your body the way it deserves. So if you're seeing signs, maybe less morning wood, more urgency when peeing, or just feeling disconnected, please don't ignore it. Listen to your body. Speak to a urologist. Bring it up during your next checkup. And remember, the goal here isn't just to fix problems, it's to prevent them. You don't need to be chasing youth. You just need to be protecting your health. And that includes caring for the parts that make you feel like you, your confidence, your strength, your manhood. No matter what you've been through in life, surgeries, relationships, illnesses, you have every right to experience peace, comfort, and pride in your body. Even now, especially now, because getting older isn't the end of anything. It's just a new chapter, and in this chapter, wisdom matters more than hustle. Awareness beats shame, and taking care of yourself is not selfish, it's powerful. Let's keep going, because there's one more thing most men never think about, yet it could be silently affecting their penis, their prostate, and even their long-term health. And that's stress. Yes, stress. Not just the kind that makes you sigh at the end of a long day, but the kind that builds up quietly inside your body over years, tightening muscles, narrowing blood vessels, messing with your hormones. You see, most people think stress lives in the mind, but it shows up in the body in surprising ways. And one of the first places it makes its presence known, your penis. Chronic stress raises your cortisol levels, and when cortisol stays high for too long, it lowers testosterone. That leads to low libido, weaker erections, and even increased belly fat. And let's not forget how stress affects sleep, which in turn affects everything from energy to mood to blood circulation. It's a ripple effect that can sneak up on you without warning. Have you noticed that when you're worried about health, finances, family, you just don't feel in the mood? That's not your imagination. That's your nervous system doing exactly what it's wired to do: pull resources away from pleasure and put them into survival. It's ancient biology, but the problem is, in modern life, we stay in that survival mode far too often. So what can you do? Well, here's the good news. Even a few small changes to your routine can help your body shift from fight or flight back into rest and repair. That's where healing happens. That's where vitality lives. Start by making space for calm every single day. You don't need to sit cross-legged on a mountain or chant in a temple. Just give yourself 5 to 10 minutes of quiet. No phone, no news, no responsibilities. Sit outside, listen to the breeze, take slow, deep breaths, let your shoulders drop. Let your jaw unclench. Let your mind be still. Even walking can be meditative if you're not rushing. Feel your feet on the ground. Notice the colors around you. Breathe from your belly, not your chest. These little moments, when done consistently, lower cortisol, regulate your nervous system, and bring your testosterone levels back into balance. And speaking of testosterone, let's clear up one common myth right now. Many older men think low testosterone is just something you have to live with, that it's part of the aging process, like gray hair or wrinkles. But while it's true that levels decline with age, there's a difference between a normal dip and a crash that leaves you feeling like a stranger in your own body. If you've been feeling tired, down, foggy, or just not like yourself, it might be time to check your levels. A simple blood test can tell you exactly where you stand, and depending on the results, your doctor might suggest lifestyle changes first or, if needed, explore testosterone replacement options. Now, testosterone therapy isn't for everyone, and it's not a magic bullet, but for some men, it can be a turning point away to feel reconnected to themselves, their energy, their drive. The key is to never jump into it blindly. Always work with a qualified healthcare provider who understands the risks and benefits and who monitors your heart health and prostate regularly. Because here's the truth. Taking care of your penis is not just about performance, it's about how you feel inside your own skin. Too many men carry quiet shame. They don't talk about what's changing down there. They think they're alone. But let me tell you, you are not alone. Not even close. Every day, I see men in their 60s, 70s, and beyond who are just starting to ask the right questions, who are realizing that they deserve comfort, confidence, and yes, pleasure. You deserve that too. You deserve to wake up and not feel embarrassed by your body. You deserve to move through the day without discomfort or doubt. And if you have a partner, you deserve to feel close, connected, and free of the fear that something's wrong with you. Because nothing is wrong with you. What's happening is natural. But what you do in response, that's powerful. So, where do you go from here? Start small. Take that daily walk. Swap one sugary snack for a piece of fruit. Clean gently. Hydrate often. Do your pelvic floor exercises while brushing your teeth. Breathe deeply when life gets loud. And for heaven's sake, schedule that checkup you've been putting off. Your future self will thank you for it. And as we bring this conversation full circle, I want you to remember something. This is not about chasing youth. This is about claiming your manhood at every age. It's about dignity, awareness, and honoring your body for everything it's done for you, and everything it can still do. You are not past your prime. You are not invisible. You are not too old for health, intimacy, or joy. The fact that you're here, watching this video, listening to this message, tells me something very important. You care. And that is the first and most powerful step. I hope this message sparked something in you, a sense of possibility, a bit of motivation, maybe even relief. If it did, I want to hear from you. Share your thoughts in the comments. What have you experienced? What helped you? What questions are still on your mind? Let's build a space where men can support each other without judgment, just honesty and strength. And if you found value in this conversation, give the video a like so others can find it too. Subscribe to the channel for more practical, compassionate health advice made just for you. You deserve it. Let's keep this journey going, one step, one breath, one choice at a time. Here's to living your best life, with confidence, with courage, and with care. You've earned it. Now that we've opened up this important conversation about health, care, and confidence, let's talk about something that almost never gets the attention it deserves: skin changes in the genital area. As you age, just like the skin on your hands, neck, or face starts to lose elasticity and moisture with age, the skin on your penis does too. It becomes thinner, more sensitive, and more prone to small tears or dryness. And for men who are circumcised, that exposure can make dryness even more noticeable in older age. You might notice flaking, itching, tightness after washing, or even small areas that seem irritated for no obvious reason. These can be dismissed as nothing serious, but they still impact your comfort and self-image, and they don't have to be ignored. So what can you do? First, you want to moisturize. Yes, really, a gentle, fragrance-free moisturizer, preferably one made for sensitive skin, can go a long way in keeping the skin healthy and soft. You don't need to lather up like it's winter on your elbows. Just a light touch after you shower or wash can protect the skin and help maintain its barrier. Avoid using products with alcohol, menthol, or strong essential oils in that area. What might feel refreshing to some can be irritating or even cause microscopic burns, especially on aging skin. Another simple tip: wear breathable underwear. Natural fabrics like cotton allow better airflow and reduce the risk of trapped moisture or heat. Tight-fitting synthetic materials can cause friction, sweat buildup, and even fungal infections over time. So give your body room to breathe. If you're experiencing persistent redness, discomfort, or skin that doesn't heal, don't try to self-diagnose with over-the-counter creams that aren't meant for such sensitive areas. That can sometimes make things worse. Instead, gently talk to your urologist or dermatologist. They've seen it all. This is not unusual, and they'll help you figure out what's going on. And here's something that surprises a lot of men. Skin conditions like lichen sclerosis or even early signs of penile cancer can start with what seems like just a little itch or dryness. These conditions are rare, yes, but when caught early, they're very manageable. That's why noticing changes, however small, is such a powerful form of self-care. And if you're in a relationship, here's a little bonus. Keeping your skin healthy and cared for also shows respect and love, not just for yourself, but for your partner too. You're saying, I still care. I still want to feel good in my body and with you. And that can go a long way in deepening emotional and physical intimacy. Speaking of intimacy, let's take a moment to talk about something that many older couples struggle with silently: communication. When things change in your body, it's easy to become quiet. Maybe you avoid certain moments out of fear. Maybe you start pulling away not because you don't love your partner, but because you don't know how to explain what's happening. That silence can create distance, but it doesn't have to. The truth is, intimacy after 60 doesn't have to look like it did when you were 30, and that's okay. In fact, many couples say their emotional closeness actually improves as they grow older because the pressure to perform fades, and what remains is connection, laughter, closeness, and comfort. But that closeness starts with honesty. Just a simple conversation. I've been noticing some changes lately, and I want to talk to you about it. Can open the door to mutual understanding. You don't have to have all the answers. Just letting your partner in can be the most healing step of all. And if you're single, that doesn't mean your sexual health isn't important. It absolutely is. You deserve to feel confident and cared for whether you're in a relationship or not. Self-care isn't just about appearance or function. It's about knowing your worth down now. Let's shift to something that's both simple and deeply overlooked: avoiding unnecessary strain on the area. This might sound basic, but it matters. How you sit, what kind of chairs you use, even how long you sit without standing up can affect your genital health. When you spend hours sitting in one position, especially on hard or narrow chairs, it puts pressure on the perineum, that area between the anus and the scrotum, which houses nerves and blood vessels that support the penis. Over time, this can contribute to numbness, tingling, or even pelvic pain. For men who bike regularly, especially on narrow seats without a groove in the middle, this can be a real concern. You don't need to throw your bike away or stop sitting altogether, but consider some small changes. Get up and move around every 30 to 45 minutes. Use a cushion or padded seat when possible. If you're cycling for long periods, invest in a seat designed for prostate and perineal relief. These aren't luxuries, they're investments in your long-term comfort. And finally, we must talk about something vital: urination habits. Many men notice changes in their urination after 60, things like a slower stream, hesitancy, a feeling of not fully emptying the bladder, or needing to go more often at night. It's common, and it's often connected to an enlarging prostate. Here's what's important: these changes may be gradual, but they're not something to brush aside. An enlarged prostate, known as BPH, or benign prostatic hyperplasia, isn't cancerous, but it can cause complications if left unmanaged. It can increase the risk of urinary tract infections, bladder stones, or even kidney damage in severe cases. But the good news is, treatment today is more advanced and more comfortable than ever. From lifestyle changes and medications to minimally invasive procedures that require little to no downtime, there are options for every level of severity. The sooner you bring it up, the more choices you have, and the better your outcomes will be. So, pay attention to your stream. Don't rush when you pee. Let your body finish at its own pace. Avoid holding in urine for long periods, especially if you already feel pressure in the lower abdomen. And don't be shy about telling your doctor what's changed. This is your body, your comfort, your life. You deserve to live free of fear and free of discomfort. You've worked too hard for too long to settle for less. Every small act of care, whether it's moisturizing, breathing deeply, drinking more water, or having that overdue conversation, sends a message to yourself: I matter. And that message becomes stronger with every choice you make. And now, as we approach the final stretch of this conversation, there's one last powerful shift we need to talk about, one that has the potential to transform not just your physical health, but your sense of purpose, pride, and peace of mind.